Do you know a child who you think may have autism? On this video, we're going to talk about how do you diagnose someone with autism and what the process is like. My name's Craig Kahn. I've got it going on. I'm someone who is on the spectrum and has worked with people with autism in the past. And this is Diagnostic, where we're dedicated to educating you about autism and how you can improve the lives of people with autism. If you're interested in this type of content, please consider subscribing. First of all, before we talk about the process of getting diagnosed, it's important to understand why is it important to get diagnosed. The diagnosis is not to just put a label on someone. It's to give someone the appropriate services and things that they need to succeed. A lot of people with autism, when they get the services they need and get help, then they can often develop into much more productive people and not need as much help later on in life. And that's what one of our goals should be, to make sure that people can be independent and not have to rely on other people. So the first step in getting diagnosed is getting a referral. This is going to come from someone like a pediatrician, a teacher, or someone in the child's life, and that they'll talk to the appropriate parties, and then they'll make sure that things are set up that a diagnosis can happen. Because before you need to look at the signs before you can actually diagnose it. So once there's been enough concern raised, then someone with autism or potential of autism will get an evaluation. This evaluation will have a number of experts that will focus on a number of different areas. These experts will include a psychologist, neuropsychologist who focuses on brain and behavior, speech language pathologist, and occupational therapists. They'll look at different areas in there and they'll go more in depth in different ways. So the next part of the process is direct observation. Having people who are knowledgeable in autism and the symptoms and all that look at the person in different various settings like home, clinic, or school or so. Being able to look at that and also use the previous knowledge that was gained to look for those signs will help make sure that they can find out that person and verify that they have autism. Once all these other tests have been done and they've done all that they need to do, they will talk together and they'll make the diagnosis together. And once that's done, they'll talk to the family and talk about it and explain different parts of this person, because each person's autism can be very different. So it's important to see those different things. This will also, once they get an official diagnosis, open them up to getting different benefits, hopefully benefits that can get them extra help in different areas and things that could help make them get them the skills they need to succeed. So autism is a lifelong thing, and it's something that people will have in their life, but it is a developmental disorder, so it can be improved on. So make sure to look at there and watch more videos so that you can understand more about autism.